Hello, beautiful people. How are you doing? Guys, today we are going to be doing mock examination on subdural hematoma, which include all the APIE stations, which are assessment, planning, implementation, and then evaluation, which is handing over. All right. I'm going to start with assessment, which is the first thing we are meant to do on APIE station. And this station is 20 minutes procedure. All right. So let's dive into what we have today. I approach my scene. I can see my scene is safe to approach. There is nothing to cause harm between me and my patient. I close nearby windows and the curtain to provide privacy to my patients, and then I do my hand hygiene according to WHO with an ample of gel on my palm, palm to palm, right palm over the left dorsal, vice versa, fingers interlace, fingers interlock, fingers interlock, rotational opening of the thumb, rotational opening of the thumb, tip to the finger, rotational opening of the wrist, vice versa. I enjoy my hand for 30 seconds. My hands are clean. I quickly read my scenario and approach my patient. Hello. Yeah, good afternoon. I'm Nurse Gold, one of the nurses attending to you today. How are you doing? Bless you. Okay, my darling, I am here to carry out assessments on you using Glasgow Coma Scale chart. Is it a convenient time for you, please? Bless you. Okay, dear, please, can you tell me your full name and date of birth? Let me quickly confirm that with your wristband and paperwork I have here with me. Hope you don't mind if I touch you. Bless you. Okay, your name? Joe Smith, can see Joe Smith and date of birth. All right, 7/11/1968, 7/11/1968, and your hospital number is 001234 001234. Bless you. Are you happy if I call you Smith? Good, thank you. All right, Smith, are you allergic to medication, lettuce, food, or dressing, or anything you would want me to know? No allergy. Good, I am happy to hear about that. That is why you are putting on a white wristband. Bless you. Okay, dear, as I say that I'm here to carry out assessments on you using Glasgow Coma Scale chart. Okay, so tell me, darling, are you in pain? Are you comfortable for this procedure? Oh, bless you. I'm so sorry, my darling. You're in pain. I'm sorry, my dear. If I ask you to score your pain, 0 being no pain and 10 being the highest, using Universal Pain Assessment tool, what will you score it, please? 5. Oh, bless you. That's quite high. I'm so sorry. Do you mind if I reposition you? Good. Can you take in a deep breath for me? Good. Bless you. Does it help? Not Lily. Oh, I'm sorry. Are you happy to bear the pain while I assess you? After, I'm going to check if you have any prescribed medication for pain, and I'm going to as well escalate this to the doctor. Good. Thank you so much for your cooperation. I'm going to quickly go and gather my equipment. I'm going to be back. All right. Thank you so much for your cooperation. So I quickly do my hand hygiene again according to WHO. It's an ample of gel on my palm, palm to palm. Right palm over the left dorsal, vice versa, fingers interlace, fingers interlock, fingers interlock, rotational opening of the thumb, rotational opening of the thumb, tip to the finger, rotational opening of wrist, vice versa. I draw my hand for 30 seconds. My hands are clean. So please confirm that my equipment is well calibrated and ready for me to use. Bless you. Thank you. So I am happy to proceed. Hey Joe, I am back again. Are you still happy for me to proceed? Bless you. Okay, Smith, I'm going to start with your eye opening, and I can see that your eye opening is spontaneous. So with that, I'm going to be giving you a score of 4. All right? Bless you. Okay, darling, moving over to your verbal response. Tell me, do you know where you are? You are in the supermarket. Oh, bless you, my darling. You are in the hospital, okay? Oh, bless you. You had a fall and hit back of your head on the floor. All right. That's why you are in the hospital. All right. Bless you. I can see that you're a little bit confused. And do you know who is talking to you? Your daughter. Oh, bless you, my darling. I'm not your daughter. I'm your nurse. Okay. Bless you. And do you know the time of the day we are in? 10 in the evening. Bless you. We are 9 o'clock in the morning now. I can see that you are confused to time, place, and person. Don't worry, I will keep reorienting you. All right. And with that, my darling, I'm going to give you a score of 4 on the verbal response. Okay, because you are a little bit confused. All right. Bless you. Okay, dear. Can you pop out your tongue for me? Can you do ah? Good. Can you raise your hands up? Bless you. Thank you so much for that. I can see that you obey command. And with that, I'm going to give you a score of 6. All right? Good. Okay, dear. I'm going to now quickly start checking your observation. All right? So, which of the hand do you want me to use to check your blood pressure? The left hand. Bless you. Have you ever had surgery on this hand, mates, in less than 6 months? Oh, that is good to hear. All right, so I'm going to quickly tie this cuff, occupying 2 to 3 centimeters above the cubital fossa, 80% of your upper arm. All right, good. I've done that. All right, there. I see your hands. I can see that you're no sign of infection or inflammation or sweating. I'm going to be checking your capillary refill now for 5 seconds. All right. 1, 2, 3, 4, 5. Bless you. It returned in less than 2 seconds. That is good. Okay. So I'm going to be putting probe on your finger to check your oxygen saturation level. All right. Thank you so much. I've done that. Good. All right. I'm going to quickly put my time and my date. Bless you. Okay, I can see that your blood pressure is 111 over 57 millimeter mercury. All right, let me document. Okay, bless you. Okay, and your SpO2 is 94 on the room air, which is good. I'm going to be removing blue now. All right, thank you so much. Let me document 94%. Good. Okay, dear. I'm going to be checking your pulse for 2 minutes. All right. I will want you to be silent for these 2 minutes, as I'm going to be silent as well, so I can be able to count it. All right. Good. Which of the hand do you want me to use to check your pulse? The right one. Good. Thank you. So I'm going to be putting my finger on your radial artery now. All right. Bless you. This is my clock. All right. Good. Bless you, my darling. I checked your pulse for 1 minute and your respiration for 1 minute. I'm so sorry, my darling, that I didn't tell you that I'm going to check your respiration. You know, sometimes when we tell the patients, they became anxious and it's going to alter the reading. I'm so sorry about that. All right. Okay, your respiration is 17 breaths per minute. Okay. Bless you. 17 breaths per minute. All right. And your pulse is 65 beats per minute. Okay, good. Thank you so much for that. Bless you. Okay, dear. I'm going to now check your temperature. All right. I'm going to be checking your temperature on your skin now. All right. Okay, and this on my hand is infrared thermometer. It doesn't cause any harm, all right? It's just for me to use it and point on your skin just to check your temperature, okay? Bless you. Okay, I can see that your skin, no sign of infection or inflammation or sweating, so I am happy to proceed. Good. Bless you, my darling. Thank you so much for your cooperation. And your temperature was 36, all right? Bless you. Let me document 36.0. Good. I'm going to be checking your pupil size and the reaction to the light now, okay? All right. So now is either you are looking at me on the forehead, you fix your eyes on my forehead, okay? Or you're going to use your hand to cover one side of your eye while I check the other side, and after you do the same to the other side. So which one do you want to use? You want to fix your eyes on my forehead. Oh, bless you. Thank you so much for that. All right. So I'm going to be checking your reaction to the light now. All right. Good. So I'm going to start now from the inner canthus to outer canthus. Bless you. I can see that reaction is okay. You're having size 3. Okay, here from inner canthus to outer canthus. Oh, good. Thank you so much for your cooperation, my darling. I can see that your eye size is 3 and the reaction to the light is positive. All right. Bless you. Let me document that now. Thank you so much. Size 3 and reaction is positive, which is plus. Good. Okay, my darling, I would want you now to stretch your hands like this, okay? While I apply pressure, do the same on top of your hand and then apply a little pressure. Just try to resist me, okay? So I can be able to check the power on your upper arm, all right? Good, okay? Can you stretch your hand? Good, okay? Can you try to resist me? Great. I can see that you have a normal power on your left and right arm. Okay. Bless you. Good. I would also want you to stretch your leg out the same way for me while I apply pressure on it now. All right. To also try to resist me, please. Okay. Bless you. Thank you so much. Can you stretch your leg? Bless you. Good. I can also see that you are having a normal power on your both legs. I am happy about that. You are doing so well, okay? So let me document that. Normal, okay? Okay, good. Thank you so much for your cooperation. So dear, let me quickly calculate your total GCS score. I'm going to come back to explain everything that I've done so far, okay? Good. Okay, my darling, I am back. Okay, so you are having a total GCS score of 14 out of 15. All right. Of course, your eyesight is spontaneous. All right. And then your verbal response, you have a score of 4 because you are a little bit confused to time, place, and person. All right. Coming to your motor response, yes, you are very good on that. Okay, it's very, very okay. You obey command and then you having a score of 6 on your motor response. Okay, that is making it a total score of 14 out of 15. All right, good. So moving over to A to E assessment now, because you have been talking to me very well, I can see you don't have any obstruction on your airway. Or do you have any obstruction on your airway, darling? No, bless. Moving over to B, B is your respiration. All right, bless you. I checked your respiration for 1 minute and you are having a respiratory rate of 17 breaths per minute. Okay, you are not using accessory muscle to breathe. There is no seesaw, there is no whistling, there is no unequal rising of the chest. All right, the rhythm and the depth is perfect. I am happy about that. All right, bless you. I checked your oxygen saturation level the time I put the probe on your finger. Yes, and you are having a score of 94% on room air. All right, don't worry, it's a little bit low, but I'm going to escalate this to the doctor after. All right, good. And now I'm going to move over to C. C is your circulation. I checked your blood pressure. Yes, it was 111 over 57 millimeter mercury. All right, good. And then I also check your pulse. All right, and you are having 65, which is okay. All right, the depth and the breathing is very, very fine. Nothing to worry about that. Okay, bless you. And then the time I checked your capillary leaf on your finger, good. I did that for 5 seconds and it returned in less than 2 seconds. You are well perfused. All right, there is no sign of cyanosis. Okay, I am also happy about that. All right, I move over to E. E is the exposure. All right, bless you. I checked your temperature on your skin and you are having 36 degrees Celsius. All right, it's very okay. You're not running temperature. Okay. All right, Smith. So tell me, my darling, apart from the areas of your skin that is exposed to me, are you having any sign of infection like rashes, redness, any pain, any bruises, any sore, any redness, any open wound or injury on the areas of your skin that is not exposed to me? Good, not at all. Bless you. I am happy about that. Thank you so much for that. All right, bless you. Okay, dear. Moving over to D. D is your disability. All right. I've asked you earlier, do you know where you are? you are a little bit confused. I asked you the time and the day which you are confused to time, place, and person. So I'm going to always reorient you on that and plan towards that. Okay. Let me ask you again. Are you still in pain? You are still in pain. Oh, so sorry. If I ask you to score your pain again using universal pain assessment tool, 0 being no pain and 10 being the highest, what will you score it, please? Oh, bless you. So sorry. It's still 5. Oh, I'm sorry about that. Can you still take a deep breath for me, please? Are you comfortable this way? Bless you. I'm so sorry. I'm going to escalate this to the doctor, all right? And then check if you have any pain medication. I will bring that to you. But if not, I will escalate to the doctor as well to prescribe pain medication to you, okay? Good. Thank you so much. All right, my darling. Has anybody checked your blood glucose level today? Can you remember? No. Oh, bless you. Assessor, please. And what is my patient blood glucose level today? Oh, 4.5. Good. Okay, my darling, your blood glucose level is within the normal range, which is 4.5 to 8. All right, you are having 4.5 for today. Okay, good. So here, tell me, my darling, how is your urine? Are you urinating well? Are you having pain when you are urinating? How is the color? Is it dark? Is it concentrated or is clear? You are not having pain and the color is clear. Bless you. I am happy to hear about that. That shows that you are drinking well. Are you drinking well? Oh, you know you're supposed to be taking at least 2.5 liters of water in a day. All right. Bless you. You are doing very well. Okay. Concerning your defecation, are you defecating well? Oh, you are. Good, good. No difficulty in defecation, no constipation, no pain. Is normal. Bless you. That is good to hear. Okay, good. Okay, my darling. I also checked your eyesight, the size and the reaction to the light, and the reaction is positive, and your eyesight is 3, which is okay. Nothing to worry about that. All right. And then I checked the power of your upper arm is very, very okay. You have a normal power on both arms. All right. And also I checked on the one on your legs. You have a normal power on the legs. All right. So I'm going to be asking you some questions now. All right. Bless you. I can see that you presented with a fall from 3-step ladder and you hit the back of your head on the floor. Is that so? Oh, bless you. So sorry about that. Okay. And then diagnosis of a subdural hematoma has been made with no surgical intervention required. Am I right? Good. And I can also see that you are having a high INI. Am I right? Oh, bless you. How have you been managing yourself? You are doing well. Oh, good to hear. All right. I can see your past medical history. You are having arterial fibrillation and obesity. Is that so? Good. So how have you been managing? How have you been maintaining your diet? You are doing well. Do you mind if I refer you to dietitian? I think they are going to be of help to you. Bless you. Thank you so much. Okay, I'm going to do that. Good. And then concerning your social history, I can see that you are living with your wife in a house and you work as a self-employed builder. Am I right? Bless you. And you are smoking 10 cigarettes per day since you were a teenager. Oh, bless you, my darling. Have you ever think of quitting, dear? You have. Good. I am happy to hear about that. Bless you. Do you mind if I refer you to smoking cessation unit? We have one in the hospital here. Good. Thank you so much for your consent. I'm going to do that. All right. Thank you, my darling. And then I can see that you are increased risk due to alcohol consumption with a score of 8. Oh, bless you. So sorry. Have you ever think of also quitting alcohol? You have not. It's fine. Bless you, my darling. Just take your time. All right. Problem. Whenever you are ready, darling, just let us know so we can refer you to alcohol cessation units. Okay. Bless you, my darling. And then I can also see that you have been advised to be on low sodium. How have you been managing it? Are you able to keep to the regimen? Bless you. Yes, I'm going to refer you to dietitian as you said earlier. All right. Bless you. It's bill of health to you. Okay. Good. And then I can see that you are taking digoxin and warfarin. Bless you. So how have you been managing? You know that your INI is a little bit high, and I can see that you are taking warfarin as well. Okay. It's fine, my darling. You are doing very well. All right. No problem. I'm also going to call doctor's attention on this. All right. Bless you. Thank you so much for your cooperation. And you'll have no allergy. Good. Bless you, my darling. Thank you so much for your cooperation. All right. No problem. I see that you're a little bit confused. I'm going to plan on that and also the pain you complain area. All right. Thank you. I am done with the assessment, my darling. Do you have any question for me, please? Bless you. All right. Thank you so much for your cooperation. I appreciate that. Okay. So in absence of no further question, my darling, I'm happy to tell you that I've gone to the end of this assessment. Okay. So I'm going to quickly clear my equipment on the patient's bedside and ensure that my field is clean. Okay, dear, here is the call bell. In case if you need anything, you can use the call bell. Okay, good. See, I open the doors and the curtain, and then I do my hand hygiene again with an ample of gel on my palm according to WHO, palm to palm, right palm over the left dozen, vice versa. Fingers interlace, fingers interlock, fingers interlock. Rotational opening of the thumb, rotational opening of the thumb. Tip to the finger, tip to the finger. Rotational opening of the wrist, vice versa. I dry my hand for 30 seconds. My hands are clean. Thank you. So guys, you see how I did this assessment? Okay, I started from here, from the beginning here, down here. All right. The reason why I did it this way, I have seen so many people saying they missed to do oxygen saturation level, they missed to check the respiration, they couldn't see where to chart it. Please, to avoid you missing anything at all on this assessment, start from the beginning, follow it as clearly as it is here down. Then you can now come back and explain to the patient from here down again. That is it. All right, and also do it in other ways. All right, there's so many ways to do this assessment, but I prefer to do it from serially from here as it is on this chart. All right, thank you so much for watching this video so far, and the next one we are coming back to do is planning. Remember that planning is 14 minutes silent station. Okay, so let's move over to planning. Our nursing problem number 1 is Joe Smith is having confusion, or Joe Smith is experiencing confusion with a GCS score of 14 out of 15. Nursing aim is Joe Smith will be oriented to time, place, and person after nursing intervention. Re-evaluation day. Joe Smith will be re-evaluated today, 10 to 2025, every 15 minutes and as clinical condition changes. Moving over to nursing intervention. 1. Explain all aspects of care to Joe Smith and gain consent for all the nursing intervention. Monitor Joe Smith's vital observation as per GCS score of 14 out of 15 using Glasgow Coma scale and escalate to the doctors and nurses in charge. Assess Joe Smith's level of confusion to time, place, and person and escalate accordingly. Reorient Joe Smith to time, place, and person frequently to reduce the level of confusion. Teach Joe Smith the indication and side effects of his due prescribed medication. Administer due prescribed medication to Joe Smith and monitor its effectiveness after 30 minutes of administration. Refer Joe Smith to neurological team and medical team for proper management. Encourage Joe Smith to make use of the call bell and ensure that the call bell is at his reach. Document all the care rendered to Joe Smith with date, time, and sign. Thank you. The next nursing problem that we identified during the assessment of Mr. Joe Smith is pain, as he is complaining of pain of 5 using universal pain assessments too. So we are managing pain. Our nursing problem is Joe Smith is experiencing pain with a pain score of 5 out of 10. Joe Smith will verbalize reduced pain with a pain score less than 3 out of 10 after nursing intervention. Re-evaluation day. Joe Smith will be re-evaluated today, 10/2/2025, every 15 minutes and as clinical condition changes. Explain all aspects of care to Joe Smith and gain consent for all the nursing intervention. Assess Joe Smith's level of pain using Universal Pain Assessment Tool and escalate accordingly. Monitor Joe Smith's vital observation using Glasgow Coma Scale as per GCS score of 14 and escalate accordingly. Encourage Joe Smith to take deep breathing exercise to enhance relaxation and reduce pain. Encourage Joe Smith to make use of diversional therapy, such as watching television, to divert his attention from the pain and thereby reducing pain. Assist Joe Smith in an appropriate depositioning to reduce pain and promote comfort. Teach Joe Smith the indication and side effects of his prescribed medication. Administer Joe Smith prescribed medication and monitor its effectiveness. Refer Joe Smith to pain management team and neurological team for expert management. Encourage Joe Smith to make use of the call bell and ensure that the call bell is at his reach. Document all the care rendered to Joe Smith with date, time, and sign. That is it, guys. We are done with planning. Now, we are coming back to do our implementation, which is 15 minutes procedure. Please, if you have watched this video so far, don't forget to give me a thumb up, subscribe, comment, like, and share. Thank you. I approach my scene. I can see my scene is safe to approach. There is nothing to cause harm between me and my patient. I close the curtains and the window to provide privacy to my patients, and then I do my hand hygiene according to WHO with an ample of gel on my palm to palm, right palm over the left dozen, vice versa, fingers interlace, fingers interlock, fingers interlock, regional open of the thumb, regional open of the thumb, tip to the finger, regional open of the wrist, vice versa. I dry my hand for 30 seconds. My hands are clean. I quickly read my scenario. My time is 14:00 hour and date is today, and it's a 15 minutes procedure. Okay, and I approach to my patient. Hello. Hi, I'm Nurse Gold, one of the nurses attending to you today. Okay, so I am here to administer your due prescribed medication that is due on my time, which is 14:00 hour. Is it a convenient time for you, please? Bless you. Okay, my darling, please, can you tell me your full name and date of birth? Let me quickly reconfirm that with your wristband and paperwork I have here with me. Hope you don't mind if I touch you. Bless you. Thank you. And your name? Joe Smith. Okay, I have here Joe Smith, and date of birth 7/11/1968, 7/11/1968. Bless you. And your hospital number is 001234, 001234. Do you mind if I call you Smith? All right, Smith. Are you allergic to any medication, let's say food or dressing, or anything you would want me to know? No allergy. Bless you. I can see. That's why you are putting on a white wristband. I can see also on my book there is no known allergy. Bless you. Are you comfortable for this procedure, or are you in pain? Bless you, you are in pain. Oh, I'm so sorry about that, okay? If I ask you to score your pain, 0 being no pain and 10 being the highest, what will you score it, please? 5. Oh, I'm so sorry about that, all right? Do you mind if I reposition you? Can you take in a deep breath? Does it help? Not at all. Good. So sorry about that. I'm going to check if you have any prescribed medication. All right. I'm going to administer that to you, and also I will escalate it to the doctor afterwards. All right. Bless you. Thank you so much for your cooperation. Okay, my darling, I'm going to go and read my medication trolley closer to you. Okay. And then I will read the prescription charts loudly so you can hear me. I will explain the indication and side effects of the medication before I dispense it. All right. Thank you. This is the call bell. In case if you need anything, you can ring the call bell. All right. Okay, so I do my hand hygiene according to WHO. General flow of gel on my palm to palm, right palm over the left dozen, vice versa. Fingers interlace, fingers interlock, fingers interlock. Rotational lobe on the thumb, rotational lobe on the thumb, tip to the finger, tip to the finger, rotational lobe on the wrist, vice versa. I air dry my hand for 30 seconds. My hands are clean. Hi, Smith. I am back again. Are you still happy to take your medication? All right, so I'm going to be reading the prescription chart with you now, okay? All right, so I have here with me hospital medication prescription and administration record for Smith Joe. Date of birth is 7/11/1968. Hospital number is 001234. Ward is MAU. Date of admission is today. Height is 1.80 and weight is 105 kg. Body surface area not given. Consultant is Dr. Kane and time of admission is 8:00 hour. So I flip over these charts. I'm still having the same patient detail, 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 still having the same patient detail. Joe Smith, date of birth is 7/11/1968, hospital number is 00123445, ward is MAU, and date of admission is today. Height is 180, weight is 105 kg, body surface area not given. Consultant is Dr. Kane and time of admission is 8:00 hour. Assessor, I can confirm that I have the right prescription charts. All prescriber must complete the signature record. Name is B. Kane and NMC number is 34540. Signature is B. Kane and BIP number is 241. Assessor, I can confirm that this medication prescription chart is correct, legible, and complete for me to proceed. I am happy to administer. Detail of the person administering this medication. I am going to come back to fill this information after I must have administered this medication. Allergy, there is no known allergy and is being signed by Dr. B. Kane and BIP number is 241 and date is today. Moving over to the next page, still having the same patient detail, Joe Smith. I have prescribed oxygen. Start date is today. Time is 8:00 hour to 10:00 hour. And this medication has been administered and well signed by the person that administered this oxygen. Prescriber signature and BIP number is also here. So I am happy to proceed to the next page. Still having the same patient detail, Joe Smith. I have information for prescriber, which I'm going to make use of as I am administering this medication. Once only medication I have today is paracetamol. Dose is 1 gram. Route is IV. Instruction is for pain. Time required is 9:00 hour. Prescriber signature and BIP number is BKL and time given is 11:00 hour, and it has been signed by the person that administered this medication, and pharmacy check is also here. Another one I have for today, medication is vitamin K. Time required is 13:00 hour. Time of giving is 13:05, and it has been signed by the person that administered this medication. Doctor signature and BIP number is also here, so I am happy to proceed to the next one. Still having the same patient detail, Joe Smith, I have here antimicrobial drug. There is no prescribed antimicrobial, so I am happy to proceed to the next one. Still having the same patient detail, Joe Smith, I have here medication for today is cocodamol. Dosage is 16/1000 milligram. Frequency is TDS. Route is oral. Duration is for 7 days. Time required is 14:00 hour. Start date is today and finish date is for 7 days. Prescriber signature and BIP number is BKL 241. Pharmacy check is also here, BKL. Okay, my patient has taken paracetamol around 11:00 hour. So I have here 12, 1, 2. Okay, so I'm not going to be administering this cocodamol as my patient has already taken paracetamol by 11:00 hour. Is not up to 4 hourly interval. So just me, I'm sorry, you are having cocodamol that is due on my time, which is 1400 hour, but is given 4 hourly. And I know that you have taken medication, once only medication paracetamol, and cocodamol contain paracetamol. Okay, I'm sorry, I'm not going to be administering this medication to you. I will escalate to the doctor to prescribe another type of analgesic for you. All right, bless you. Thank you so much, my darling. So moving over to the next one, I have here the Digoxin. Date is today. Dose is 125 microgram. Frequency is once daily. Route is oral. Duration is continuing. Time is 1400 hour. Finish date is continuing. Prescriber signature and BIP number is Dr. Bikel 241. Print name is Bikel. Okay, assessor, please, what is my patient's blood pressure level and pulse rates within the normal range? Oh, bless you. Thank you. All right. Smith, you are having the Digoxin, all right? So the Digoxin is being taken to manage irregular heartbeats, okay? So side effect of this medication is nausea and vomiting, all right? Don't worry, I'm going to keep reassessing you, okay? But if anything should happen before then, please, you can ring the call bell, all right? So Smith, are you happy to take this medication? Bless you. All right, so I'm going to be dispensing the medication now. All right, I quickly open my trolley and then get my Digoxin. All right, so I have here with me Digoxin. On my paperwork is Digoxin, and dosage on the paperwork is 125 microgram. Then on my container, I am having 125 microgram per tablet. Expiry date is 10/2/2029. It's still valid and intact. I am happy to dispense. So I'm going to be dispensing this medication now. A tablet of this medication. Putting it in a separate cup. Return to the trolley. All right, Smith. So we proceed to the next one. Still having the same patient detail, I also have here today as required medicine, paracetamol. Date is today. Dosage is 1000 milligram. Frequency as needed. Route is oral. Duration is continuing. Start date is today. Finish date is continuing. Prescriber signature and BIP number is Bikel 241. Print name is Bikel. Okay. So Smith, you are having paracetamol under as required medication. I know you complained of pain earlier. Are you still in pain? Bless you. If I ask you to score the pain using Universal Pain Assessment tool, what will you score it, please? 0 being no pain and 10 being the highest. 5 is still 5. Oh, bless you. Okay, you know what? I'm going to escalate this to the doctor because you have taken paracetamol injection by 1100 hour, and I am giving you medication that is due on 1400 hour. So if we are going to count it, that is 12, 1, 2. You can see it's within 3 hourly, is not up to 4 hourly interval. All right. So I will escalate to the doctor to prescribe another type of pain management medication for you. All right. Bless you. Thank you so much for your cooperation. Okay. Good. Moving over to the next one, still having the same patient detail, Joe Smith. Prescribed infusion, there's no prescribed infusion. And then I have omitted dose of medicine code. All right, I'm going to come back to code the ones that I omitted. Okay, I carry my medication back to my patient. Okay, Smith, I am back again with your medication. All right, so please, can you still tell me your full name and date of birth? Let me quickly confirm that with your wristband again and paperwork I have with me. I'm sorry, I know I have asked you earlier, okay? I just wanted to make sure that I'm still with the right patient, okay? Bless you, okay? Name, please. Joe Smith, I have here Joe Smith, and date of birth. 7/11/1968, 7/11/1968, and your hospital number is 001234, 001234. Bless you. I can see that I still have the right person. So, Smith, are you allergic to any medication, lettuce, food, or dressing at all, or anything you would want us to know? No allergy. Bless you. I have here with me no allergy on the paperwork, and your wristband. I can see you are putting on a white wristband. That shows you don't have any allergy. I am happy about that, right? So are you still happy to take your medication, darling? Bless you. You are happy to take your medication. Good. All right. So you are having today the digoxin, as I explained earlier, okay, is used to manage irregular heartbeats. All right. And assessor have told me that your heart rate is within the normal range. Okay. Assuming that is below 60, I wouldn't have administered this medication, but assessor told me that it's still within the normal range. So I am happy to administer this medication to you. Okay. Bless you. While I give you this medication, I'm going to assess your swallowing ability. All right. Are you swallowing very well? All right. Bless you. Can you take a sip of water for me so I can assess your swallowing ability? Good. Can you do ah? Bless you. That shows you are swallowing effectively. Okay. So here is your tablet, digoxin. Here is a sip of water. Bless you. Can you take a sip? Good. Thank you. Can you drink a little more? Bless you. Thank you so much for that. Okay. Can you do ah? Bless you. Thank you so much. I'm so sorry. I just wanted to make sure that you have swallowed it very well. All right. Bless you. Okay, dear. As you told me that you are in pain earlier, I'm going to escalate you to doctor to prescribe another type of pain medication for you. All right. Because it's not up to 4-hourly interval for me to administer your cocodamol or prescribe paracetamol that is due under as required medication. Okay. Bless you. Thank you so much. So, dear, let me quickly document all the medication that I have given so far. All right. Good. So, I quickly chart my omitted medication, cocodamol. I put my date is today, 10/2/2025. Drug is cocodamol. Dosage is 16 over 1000 milligram. Route is oral. Instruction is for pain. Time of giving, not giving. Reason for omission. Paracetamol has been given as a start dose. Signature, put my signature. Bless you. So moving over to the digoxin. I sign my digoxin. Hey, my darling, thank you so much for your cooperation so far. I am done with administration of this medication. All right. Do you have any question for me? Bless you. Okay, dear, I'm going to come back after 30 minutes of administering this medication to assess you the effectiveness of the medication. All right. Bless you. Okay, dear, here is the call bell. In case if you need anything, you can bring the call bell. Okay. All right. So I quickly clear my equipment and bring out my trolley from the patient side, and then open the curtains and windows. Do my hand hygiene according to WHO. A sample of gel on my palm to palm, right from over the left dozen, vice versa. Fingers interlace, fingers interlock, fingers interlock. Rotational lobbing of the thumb, rotational lobbing of the thumb. Tip to the finger, tip to the finger. Rotational lobbing of the wrist, vice versa. I dry my hand for 30 seconds. My hands are clean. Thank you. Make use of 12 minutes to do this administration of a medication during your practice, okay? So that you can get used to it. At the day of your examination, you can finish and have enough time to sign all the medication you have given, the omitted, the reason why you omitted it, your details of the person administering the medication. You make sure you sign it full, and also the ones that you administer, all right? Thank you, guys. Still remember to subscribe, comment, like, and share. Let's move over to evaluation. So, guys, this evaluation is 8 minutes station. All right. So, my scenario is like this. Joe is being transferred to pre-discharge lounge prior to being discharged home later this evening. Hello, I'm Nurse Gold from Medical Assessment Unit. I am here to hand over my patient, Joe Smith. Are you a nurse from pre-discharge lounge? Good. All right. So I am here to hand over my patient, Joe Smith, and date of birth is 7/11/1968. Hospital number is 001234. Ward is Medical Assessment Unit. Date of admission is today. Time of admission is 8:00 hour. Height is 1.80. Weight is 105 kg. Consultant is Dr. Ken. All right. So I am handing you over for continuity of care prior to his discharge this evening, okay? Joe Smith presented with a complaint of falling off from three-step ladder and hit his head on the floor. And diagnosis of subdural hematoma was made with no surgical intervention, but he is having high INI, okay? Past medical history is arterial fibrillation and obesity. Social history, he lived with his wife in his house and he worked as a self-employed builder. He smokes 10 cigarettes per day since he was a teenager. He has increased risk due to alcohol consumption with a score of 8 and has been advised to be on low sodium diet. Drug history is digoxin 125 microgram once daily and warfarin 3 milligram once daily, and he has no known allergy. Okay, so assessment was done using Glasgow scale. During the assessments, blood pressure was 111 over 58 millimeter mercury, heart rate was 65 breaths per minute, and respiration was 17 breaths per minute. SpO2 was 94 on room A. Pressure was 36.0. Okay, and he has a good eye reaction to the lights and also good size of 3 on both eyes. Okay, and came out with a GCS of 4.46, which is 4 on the eye opening, verbal response is 4, and motor response is 6. All right, and then he has a normal power on both upper arm and the legs. So currently his temperature is now 36.6 to compare to what it was before. It was 36.0. All right, and pulse is now 90 beats per minute, but initially it was 65 beats per minute. Respiration is now 19 breaths per minute, but it was 17 breaths per minute previously. Oxygen saturation level is now 98% on the room air, but initially it was 94% on the room air. Blood pressure is now 150 over 75 millimeter mercury, but it was 111 over 57 millimeter mercury previously. And GCS score is now 4.56, which is a total of 15 out of 15. But initially it was 4.46 with a total of 14 out of 15. Okay, and then you can see that Mr. Ben is actually doing so well. Okay, so during assessments, nursing problem that was identified is pain, as he is complaining of pain at the back of his head with a pain score of 5 out of 10. Good repositioning was carried out, deep breathing exercise and diversional therapy, which was quite effective. All right, and also during the assessment, another nursing problem that was identified is confusion. He's having confusion to time, place and person, but he was frequently oriented to time, place and person. Currently he is doing very well. All right, and during medication administration, paracetamol was prescribed for him, which is due on my time, but I could not give the medication because it's not up to 4 hourly interval, as he previously took it around 11:00 hour. Okay, please, he is still complaining of pain. I would want to escalate this to the doctor to prescribe another type of pain medication for him to relieve his pain. All right. Also, cocodamol was as well prescribed, which is due on my time, but I could not give the cocodamol as well because of the paracetamol he has taken previously around 11:00 hour. Okay, please help me to escalate this to the doctor for proper management. All right. Bless you. And during the assessment, he agreed for us to refer him to smoking cessation unit. Okay, please, I would also want you to do that. Okay, I would also want you to continuous assessment and monitoring of Joe Smith for proper management. All right. Okay, and during assessment, I noticed that his INI is high and he is taking warfarin. Please escalate this to the doctor so that we can be cautious management. All right, as he is at risk of bleeding. Okay, bless you. Thank you so much for your cooperation. Do you have any question for me, darling? No question. Bless you. In the absence of no further question, I am happy to tell you I am done with the handing over. Thank you. Guys, this is it. Very simple. Very, very simple. Make sure you note what they want you to note. You can see that this patient is having high INR, all right, and he is taking warfarin. You can see he's at risk of bleeding. Yes, that was why I told him to escalate this to the doctor for proper management. All right. And also the medication I didn't give, I also handed it over for her to escalate to the doctor to prescribe another type of medication to my patients. This is the 8-minute procedure. Please don't waste your time reading, and reading. Practice this thing over and over again. Use 60 minutes to do your practicing during your learning period. Okay, I wish you all the best in your OSCE examination. Believe in yourself, trust in yourself. That is the highest thing you can do. Have that confidence that I can do this. Always practice and practice and practice. Thank you so much for watching this video so far. Please, I want you to subscribe, comment, like, and share. I appreciate all of you for your subscription. Bless you. Thank you so much. See you on my next video.